Hello everyone, welcome to Sapiomed Medical Podcast, where we simplify science, inspire minds and shape the future of healthcare through meaningful medical conversation. I'm your host Daniel Ahinodro, and today we are diving into one of the most fundamental and frequently requested blood tests in medicine, the full blood count or the complete blood count. This is the very beginning of our hematology series, and to understand hematology very well, you must understand the blood itself and how we assess it through laboratory investigations like the full blood count or the FBC. So plug in your headphones, grab your notebooks, or just relax. Let's unpack this powerful diagnostics tool that tells us a lot more than your blood level. In section 1, we are going to take a brief look at what the blood is in itself. So when we speak about the blood, we are talking about a life-sustaining fluid that transports oxygen and nutrients. It also removes waste, regulates body temperature and the pH, and it serves as a crucial line of defense against infections. When we talk about the white blood cells and injuries as well. The blood in itself consists of two main parts. We have the plasma element and then the foam element, or you can say the plasma component or the foam element. The plasma component contributes about 55% of the whole blood, and it is made up of the fluid part, which is mostly water with proteins, hormones, electrolytes and nutrients. The foam element is about 45% of the entire blood, and the foam element consists of the red blood cells that is responsible for the transport of oxygen, the white blood cells that is for immune defense, and then the platelets for clothing. In today's task, the full blood count evaluates these components more into details. Now, let's dive a little bit deeper into the full blood count essentials. So what is full blood count as a whole? So full blood count is a routine blood test that is used to evaluate the overall health and detect a wide range of disorders like anemia, infections, inflammation, and blood cancers as well. So normally this test is usually performed using automated hematology analyzer, many of which we use the flow cytometry and the electrical dependence principle to measure and classify blood cells quickly and accurately. Now let's break these down into what it measures, the reference ranges, and their clinical significance. So we are basically going to group these categories into three main parts based on the blood components that we have. So we are going to talk about the red blood cell and its indices. We are going to talk about the WBC or the white blood cells and its differentials. Then we are going to also talk about the platelets and also the sub parameters that follow the platelet. So let's delve much deeper into the red blood cells and its parameters. In the red blood cells, we can talk about hemoglobin. So what is hemoglobin in itself? So hemoglobin is a protein in blood cells that carry oxygen, and the reference range for hemoglobin in men is 13.5 to 17.5 gram per deciliter, and the reference range in women is 12.0 to 15.5 gram per deciliter. So what is the significance of hemoglobin? Why should you take a look at your hemoglobin or take it very serious or critical? Let's take the significance of hemoglobin. So low hemoglobin is an indication of what we call anemia, and high hemoglobin is an indication of what we call polycythemia. So when we talk about anemia, we are talking about blood loss, which could be due to iron deficiency, chronic disease, or any other thing that will reduce the amount of blood or hemoglobin content within your body. And then we have high hemoglobin, which is also a medical condition we call polycythemia. Polycythemia could be as a result of tumors mostly, or it could be as a result of dehydration and also lung diseases as well. So this is basically what hemoglobin is about. And hemoglobin also varies from place to place. Those that lived in higher areas or mountainous areas seems to produce a lot of these hemoglobin. So the reference range is classified based on a whole lot of categories. We can talk about age, talk about physiological conditions, when we talk about physiological conditions, we are trying to say women. We also pregnancy, and also some peculiar health conditions will also allow the hemoglobin to be grouped in a category of reference range. And then we can also talk about place of residence or location. So people that are living in a higher altitude may also have the tendency to produce a lot of these blood cells. Therefore, their reference range is quite or slightly different from those that live in lowlands. So that is for hemoglobin. As we move on and we progress in hematology, we are going to talk so much about hemoglobin formation. We are going to talk about anemia and all that. This is just a brief version and the full blood count. Now let's move to our next hematological parameter, that is the hematocrit. So for the hematocrit, what are we talking about? The hematocrit, which is also known as the HCT or the PCV, is the proportion of blood volume that is occupied by a red cell. So when you take a full blood or a whole blood and then you allow the blood to settle, the portion that the red cells occupy is what we call the hematocrit, or the proportion of the settled blood cells, red blood cells, against the other component of the whole blood is what we call the hematocrit. And the hematocrit too has a reference range. Hematocrit in men is within a range of 41 to 53%, and hematocrit in women is within the range of 36 to 48%. And the significance of hematocrit is also to assess anemia. Low hematocrit tells us that there is anemia. And then high hematocrit also tells us there is polycythemia or dehydration as well. So you could see there is some kind of positive correlation between hematocrit and hemoglobin as well. Now let's take a look at the red blood cell count. So we are talking about the real red blood cell count. So this is the total number of red cells per volume of blood. So when we take a particular amount of volume of blood, the amount or the number of red cells in the blood is what we know, we term as the red cell count or the red blood cell count. So for the reference range, we have about, for men, we have about 4.7 to 6.1 million cells per microliter. So this reference range could also be presented in a different unit, okay? But what you have to know that is 4.7 to 6.1 million cells per microliter. And then for women, we have 4.2 to 5.4 million cells per microliter. Normally, when the full blood count is printed for you, or when you view your full blood count results, the reference ranges are given, and these reference ranges are based on, it could be geographical location, it also could be the kind of analyzer that is being used, but definitely it's going to give you the reference. The reference ranges are going to be provided for you in your printed red blood cell count results or full blood count results. So you are going to know whether you fall below the reference range or you fall above the reference range. Let's talk about the clinical significance of the red cell count. So in the clinical significance of the red cell count, we say that an elevated red cell count is an indication of what we call a polycythemia vera or chronic hypoxia. So polycythemia vera is the abnormal proliferation of the red cells. It could be as a result of cancer, it could be as a result of anything that got to do with blood cancer and all that. So that is for the polycythemia vera. And then for chronic hypoxia, when we talk about hypoxia, we are talking about the body not getting enough oxygen or the blood not getting enough oxygen. And as we move along, we'll get to know that hypoxia triggers certain cytokines that are found within the body, or certain what we call it, or certain proteins that are found in the body. For instance, in red blood cell production, when there is hypoxia, the erythropoietin hormones that are found within the kidneys stimulate the production of red blood cells. So they stimulate the process we call erythropoiesis. Erythropoiesis is basically the formation of red blood cells. So in response to hypoxia, the erythropoietin hormone is released in the bloodstream to its target organs. And when we talk about the target organs in these particular scenarios, we are talking about the hematopoietic or erythropoietic receptors that are found in the red blood cell progenitors, and this causes the increase in the production of red blood cells. So that is for chronic hypoxia. And for low red cell count, it could also be attributed to anemia, or what we call bone marrow suppression, or bone marrow aplasia as well, or red cell aplasia. Okay, so that is for the red blood cells. Now let's move on to the mean cell volume, or what we call the MCV. In other books, you would see mean corpuscular volume. Now it is basically the size, how big the red cell is. The size of the red cell. And the mean cell volume tells a lot, especially when we dive into anemia. It classifies anemia into different types: the megaloblastic anemia, the microcytic anemia, the macrocytic, the monocytic, and all that. As we move along and we talk about anemia, we are going to know all of these things. Now, what is the mean cell corpuscular volume? It is the average size of the red blood cell. When we talk about the average size of the blood cell, we are talking about how big or small the red cell is. And normally it is given in the reference range of 80 to 100 femtoliter. So low MCV is also a suggestion of what? Of microcytic anemia, as I said earlier on. And examples of microcytic anemias that we have is iron deficiency anemia and thalassemia. You can check out in our videos on iron deficiency anemia and thalassemia. You'll get to understand what microcytic anemia is. And high MCV is an indication of macrocytic anemia. When we are talking about macrocytic anemia, we are talking about the folate deficiency or the vitamin B12 deficiency anemia. Now let's move on to mean corpuscular hemoglobin, which is also known as MCH. So for the MCH, we are talking about the average amount of hemoglobin content that is found in a single red cell or per red cell. And normally it's given in the range of 27 to 33 picogram. So the unit for measuring this MCV is picogram, and the range is 27 to 33 picogram. And this reflects the color or the paleness of the red cell. So you realize that a high MCV tells us that there's a whole lot of hemoglobin in the red blood cell, and a low MCV will tell us that the blood is short of hemoglobin. So microscopically, if you take a look at the red blood cells under the microscope, you realize that the red blood cells that are having a low MCV will appear pale or will have a huge central pallor. When we talk about central pallor, is that kind of that kind of roundish thing that you find within the red blood cell center. That is the central pallor. So the bigger central pallor, it tells us that there is a reduced amount of hemoglobin, and then the smaller the central pallor or the thicker the central pallor tells us that there is a high amount of mean cell hemoglobin or hemoglobin content. Alright, now let's move on to the mean corpuscular hemoglobin concentration, also known as the mean cell hemoglobin concentration. Now, what is MCHC? It is the average concentration of hemoglobin in a given volume of blood. So when we take the least amount volume of blood we take, the amount or the total concentration of hemoglobin in that given amount is what we know or what we term as a mean corpuscular volume. And the reference range for mean corpuscular volume lies in 32 to 36 gram per deciliter. And realize that the hemoglobin parameter is measured in the same unit as the mean cell hemoglobin concentration as well. And the significance of mean cell hemoglobin concentration is also to determine hypochromic cells, commonly in iron deficiency anemia, and also high mean cell hemoglobin concentration may suggest what we call the spherocytosis or dehydration. Now, spherocytosis might be a strange term, but as we move along, we are going to talk about red cell variations and red cell variation in shapes and sizes. That is anisocytosis and poikilocytosis, and you are going to know all these terminologies that are involved. Alright, now let's move on to the red cell distribution width, which is also known as RDW. So what is the red cell distribution width? It is the variation in size of red blood cells when when we are talking about variation in sizes, we are talking about how small or how big the red cell sizes are in a particular amount of blood. So the RDW tells us what we term as anisocytosis. We are talking about anisocytosis. We are talking about the variation in red cell sizes. Yeah, and poikilocytosis tells us the variation in red cell shapes. So that is for anisocytosis. And when we take a critical look at the red cell distribution, with the reference range lies within the range of 11.5 to 14.5%. And the significance of this is to determine mixed population of what? Of small and large red cells. And it also used to determine or detect early nutritional deficiencies such as iron deficiency anemia and vitamin B12 deficiency anemia. So gradually we've come to an end of the red blood cell parameters and indices. Now we are moving straight to the white blood cells. In the white blood cells, we have a whole lot to talk about, because the white blood cells, you see, they are different WBC differentials that we can talk about them. Alright, so let's begin with the white blood cells. Alright, so when we talk about white blood cells or WBC, what are we trying to talk about? We are trying to talk about the cells that are responsible for the fighting of infection. White blood cells are mostly they are the cells that are involved in our immune defense. And what do they do to ensure immune defense? They either produces chemical substances we mostly call chemokines or cytokines to fight against the diseases, or they actually attack them by engulfing, or what we call phagocytosis. Alright, so the total number of white blood cells in a sample ranges in 4,000 to 11,000 cells per microliter. 4,000 to 11,000 cells per microliter. And the significance of the white blood cell, when we have a high white blood cell, we are talking about leukocytosis. That is the term that is used to talk about high blood cells. So here, in this particular, under this white blood cell, we are going to get ourselves familiarize ourselves with certain keywords like leukocytosis, which means high amount of red blood cells, leukopenia, which means low amount of white blood cells. So when we talk about leukocytosis, we are talking about high white blood cell production. And high white blood cell production could tell us, or could be an indication of what? Of infection, inflammation, or leukemia. Now, low white blood cells or leukopenia could be an indication of viral infection, bone marrow failure, and all of that. So let's talk about the differentials. We are going to delve much into the differentials, talk about all the parameters that are involved in the white blood cell differentials. So when we talk about the differentials, we basically have 5 basic cell types under the white blood cells. We have the neutrophils, we have the lymphocytes, we have the monocytes, we have the eosinophils, and then we have the basophils. So we are going to talk about each of these cells, talk about their reference ranges, their roles, and in situations where they are elevated or when they are declined. Okay, so for the neutrophils, they have a reference range of 40 to 75%, which means they are the abundant WBC differentials in the bloodstream, and that their role is to initiate first immune response, and also they are also predominant in bacterial defense. So anytime we see that neutrophils are elevated, our mind should go towards what? Bacterial infection or inflammation or stress. And anytime neutrophils decrease, we should also gear our mind towards bone marrow failure or viral infection. So a higher amount of neutrophils could tell us that there is some form of bacterial infection, and then a very, very low, significantly low amount of neutrophils could tell us there is what? A bone marrow failure or a viral infection. Now let's move on to lymphocytes. So lymphocytes actually is in the range of 20 to 40%, and that is the second highest amount of blood cells, or highest blood cell in the blood, highest white blood cell in the blood. So lymphocytes have a range of 20 to 40%, and the primary role of lymphocytes is viral defense and immune memory. So anytime there is a viral infection, it is the lymphocyte that is responsible for the fighting or the defense against viral infection. So in every viral infection, realize that there is an elevated amount of lymphocytes, a significantly elevated amount of lymphocytes, and also it's also raised in chronic illness as well. Now, in situations or diseases such as HIV, and then also when we take steroids, what happens is that the lymphocytes decrease, because in HIV, remember that HIV, the disease, the virus attacks the lymphocytes, the B lymphocytes and the T lymphocytes as well. So in HIV, there is a decline in lymphocyte production, because that is the cells that are being attacked by the viruses. Okay, so let's take a look at the monocyte. So the monocyte is the next abundant blood cell in the body, and monocytes are in the reference range of 2 to 8%, and they are mostly involved in phagocytosis and then cleanup of red cells. Monocyte in tissue is known as what? Macrophages. Monocyte in tissues is known as macrophages, and you know that the role of macrophages toward clearing of phagocytosis or clearing up of either cellular debris or talk about infections or viruses, bacteria, viruses, or pathogens. Let me put it that way. So an increase of monocytes is an indication of a recovery phase. When you are having a disease and you're in the recovery phase, there could be slightly elevated monocyte. Yeah, and then also in diseases such as tuberculosis, there is high monocytes. So we term it as monocytosis. There is monocytosis. Yes, monocytosis. And in issues that, or in situations that monocyte is declined, we can classify those situations or name those situations as bone marrow issues. Yeah. So in bone marrow issues, they are declined hot monocytes. Let's go to eosinophils. So eosinophils is the last but one least, white blood cell type, and eosinophils is in the range of 1 to 6%. Now, eosinophils is mostly predominant in allergic infection and parasitic infection. So once there is an allergy, remember that there is an elevated level of eosinophils, and also eosinophils decreases in steroid use as well. Now, beside allergies, so in situations like asthma or worm infection, so for the parasitic infection, mostly it's helminthic infection. Yeah. So when there's worm infection, there is a high elevation of eosinophils. Now, basophils is the least amount of white blood cells. It's less than 1%, and it's responsible for the release of histamine, and then allergy response to as well. So it is also raised in myeloproliferative disorders. We'll talk about myeloproliferative disorders in future videos. And then it's also decreased in rarely significant cases, because it's significantly low. So basically it's in the range of 0 to 1%. So when you have basophil decreased, it's nothing. Yeah. So let's take a quick diagnostic pattern clues for these white blood cell parameters. So high neutrophils, there is an indication of what? Bacterial infection. Higher lymphocytes, viral infection. Higher eosinophils, allergic or parasitic infection. Alright. Now let's move on to the last parameter, that is the platelets. So let's talk briefly about the platelets. So here we are going to talk about the platelets and their parameters as well. So normally platelets, the reference range of platelets in blood is around 150,000 to 450,000 microliter. And the significance of platelet is to tell whether there is a low platelet indicates whether there is thrombocytopenia. Thrombocytopenia basically means low platelets, and thrombocytopenia, there could be bleeding risk, and also high platelet amount represents what? Thrombocytosis. And in thrombocytosis, we are talking about clotting risk, inflammation, and other myeloproliferative disorders as well. Now let's take a look at the platelets parameters, the parameters under the platelets. So we have the mean platelet volume, which is also known as MPV. So mean platelet volume is basically the average size of platelets, and it has a reference range of 7.5 to 11.5 femtoliter. And the significance of the MPV is to tell whether there is a younger platelet or a lower platelet. So for the younger platelets, they are mostly more active platelets, and for the older platelet, they are mostly less active platelet. So high MPV tells us that they are more active platelets, and low MPV tells us what? That they are low platelets, active platelet. So this is basically what full blood count or complete blood count is. That is the most essential thing you have to know under full blood count or complete blood count. So there you have it. The full blood count isn't just a number on a lab sheet. It's a powerful diagnostic tool that, when understood properly, tells a rich story of health, diseases, and everything between. So mastering the full blood count will equip you with the ability to screen, diagnose, and monitor disease conditions ranging from anemia to infections, and even cancers like leukemia, as we are going to see in future podcast. So if this episode helped you understand full blood count better, do me a favor, just subscribe to this podcast so you never miss an episode. Share this with your friends or colleagues who need this knowledge, and then leave a rating or a comment. Your feedback will keep us going. Now follow Sapiomed on our social media pages, especially on YouTube. This is Daniel Ahinodro, and you've been listening to the Sapiomed Medical Podcast, where we make learning medical stuffs simple, purposeful, and powerful. Stay curious, stay compassionate, and I'll catch you up in the next one. Have a wonderful day. Bye.